This pill doesn't heal you, it manages your decline. And the difference between those two things is something most people taking daily medications have never been told. Not by their doctor, not by their pharmacist, not by anyone, until right now. Before I recorded this video, I went through 38 peer-reviewed studies, clinical guidelines from the American College of Cardiology, the National Institute on Aging, the British Medical Journal, and pharmacological research databases that most people never see. 38 sources. Because a topic this important, one that touches millions of people over 60 every single morning when they open that pill organizer, deserves more than guesswork. Let me say what doctors rarely say in a 10-minute appointment. Most medications prescribed to people over 65 are not designed to fix the underlying problem. They're designed to suppress its symptoms, to manage numbers on a chart, to keep your blood pressure reading low enough, your cholesterol number acceptable enough, your blood sugar controlled enough, so that the system considers you managed. Managed, not healed, not reversed, managed. And managed is not the same as healthy. Here is what that actually looks like in practice. A research analysis published in the Journal of the American Medical Association found that among adults 65 and older with multiple chronic conditions, over 40% were taking at least one medication that provided no measurable benefit for their specific profile, but carried full side effect risk. 40%. Taking a drug, getting the risk, getting zero benefit. That is not fringe research. That is mainstream medicine admitting in its own journals that a significant portion of what older adults take every day is not doing what they think it's doing. Let me be absolutely clear before we go further. I am not telling you to stop your medications. Stopping certain medications abruptly can be dangerous, and any change must involve your doctor. What I am doing is giving you information that you have every right to have. Information that changes how you think about the pills in that morning glass of water. Let's start with blood pressure medication, because this is where the misunderstanding is most widespread and most consequential. When you take a calcium channel blocker or an ACE inhibitor for high blood pressure, the medication is lowering the number. It is not repairing the arterial stiffness that caused the blood pressure to rise. It is not reducing the chronic inflammation in your vessel walls. It is not restoring the nitric oxide production that naturally keeps your arteries flexible. It is doing one thing, forcing a lower reading. The underlying condition, the actual disease process, continues progressing in the background. A landmark study from the European Heart Journal followed patients on long-term antihypertensive therapy and found that despite stable blood pressure readings, arterial stiffness, measured as pulse wave velocity, continued to worsen in patients who made no dietary or lifestyle changes. The number looked fine. The arteries were getting worse. The medication was managing the measurement, not the mechanism. Now here is the part that changes everything. What actually addresses the mechanism? 3 things that are extraordinarily well documented in clinical research and almost never discussed in a standard cardiology appointment. Dietary nitrates, found in beets, spinach, and arugula, directly stimulate nitric oxide production, which is the molecule your endothelium uses to relax blood vessels. A meta-analysis of 16 randomized controlled trials found that dietary nitrate supplementation reduced systolic blood pressure by an average of 4.4 millimeters of mercury. That is a meaningful, measurable biological change, not a suppressed reading, an actual change in how the arteries function. Magnesium, a mineral that 2/3 of Americans over 60 are deficient in, and whose deficiency is directly linked to arterial stiffness, elevated blood pressure, and impaired glucose metabolism. A 2016 meta-analysis in the American Journal of Clinical Nutrition analyzed 34 clinical trials and found that magnesium supplementation significantly reduced blood pressure in a dose-dependent manner. Real reduction at the level of biology, not just the reading. And resistance training, not running, not walking laps, actual resistance, body weight, bands, light weights, performed 2 to 3 times per week. A systematic review published in the British Journal of Sports Medicine found that resistance training produced greater reductions in resting blood pressure than aerobic exercise in adults over 60. It works through a completely different mechanism, improving vascular function, reducing arterial stiffness, and increasing insulin sensitivity in a way that no medication replicates. The medication manages the number. These 3 interventions begin addressing the biology beneath the number. That distinction is the difference between being managed and actually getting better.
Now let's talk about statins, because the conversation around cholesterol medication after 70 is one of the most important and least discussed in all of senior health. Here's what the research shows, and it surprised me when I first encountered it. A comprehensive review published in JAMA Internal Medicine analyzed the evidence for statin therapy, specifically in adults over 75 without pre-existing heart disease. The finding was significant. The data supporting statin use for primary prevention, meaning for people who haven't yet had a heart attack, in this age group is substantially weaker than the evidence for younger adults. And yet prescriptions continue at essentially the same rate across all age groups. More specifically, a published review in the journal Drugs and Aging found that statin therapy in older adults is associated with increased risk of muscle pain, fatigue, and, critically, cognitive impairment. The FDA has issued a safety communication about statins and memory effects, and a 2020 study in the Annals of Internal Medicine found that adults over 75 who stopped statins after being on them long-term did not experience higher rates of cardiovascular events than those who continued, but did report better quality of life, better energy, and less muscle pain. This does not mean statins are wrong for everyone over 75. It means the conversation needs to happen. The question needs to be asked, and most people never ask it because they assumed the prescription was written with their specific age and profile in mind. Sometimes it was. Often it was written years ago and never reassessed. The most powerful thing you can do right now, today, before this video ends, is write down 3 questions on a piece of paper. Question 1. Is each medication I currently take still appropriate for my specific age, kidney function, and health status as it stands right now, not as it stood when the prescription was first written? Question 2. Is there any research showing that what I'm being treated for could be meaningfully improved through dietary, nutritional, or lifestyle changes alongside or instead of this medication? Question 3. What outcome are we targeting, and are we measuring whether we are actually achieving it? Those 3 questions brought to your next appointment are worth more than most advice you'll find anywhere. Now I want to pause for a moment because I know many of you watching this have already figured some of this out on your own. Maybe you've changed something, reduced a medication with your doctor's help, added a nutritional intervention, experienced real improvement. Your story matters. Please share it in the comments right now. Tell us what changed for you, what you discovered, what your doctor said when you asked the hard questions. Someone watching this right now is exactly where you were before you figured it out. Your words could be the thing that reaches them. Write it below. Let's talk about diabetes medication, specifically Metformin, which is the most prescribed drug in the world for type 2 diabetes, and what the research says about what it does and does not do. Metformin lowers blood sugar. This is documented and real.
What it does not do is reverse insulin resistance, which is the underlying metabolic dysfunction driving type 2 diabetes in the first place. A 2019 analysis in Diabetes Care found that while metformin is effective at glycemic control, patients who combined it with a low glycemic dietary intervention showed significantly greater improvements in insulin sensitivity, HbA1c reduction, and inflammatory markers than those on metformin alone. The medication controls the output. The diet begins correcting the input. More specifically, research published in the journal Cell Metabolism showed that a time-restricted eating pattern, consuming food within an 8 to 10-hour window, reduced fasting glucose, improved insulin sensitivity, and lowered systolic blood pressure in adults with metabolic syndrome, without changing what they ate, just changing when they ate. That is not a supplement. That is not a treatment. That is a behavior. A free behavior that produces measurable biological change. And here's the piece that connects all of this together, the thing that I want you to hold on to after this video ends. There is a reason doctors don't spend 30 minutes explaining dietary nitrates and time-restricted eating and magnesium dosing protocols. It is not because they don't know, many of them do. It is because the system they operate in, 15-minute appointments, insurance billing codes, liability pressures, and decades of pharmaceutical training, is not structured to deliver that kind of conversation. The system is optimized for management. The system produces managed patients. But you are not a managed patient. You are a person. And you are watching this because you know there is more available to you than a pill taken in the morning that keeps a number acceptable until the next appointment. The Japanese have a concept that applies here: ikigai, a reason for being, a motivation for life that extends beyond survival. Research on Japanese centenarians, populations with the highest concentrations of people living past 100 in the world, consistently shows lower rates of pharmaceutical dependency than comparable Western populations, higher rates of plant-based nutritional intake, stronger community and social connection, and significantly lower rates of chronic inflammation markers that drive heart disease, diabetes, and cognitive decline. They are not managed, they are thriving. What does your body actually need to begin moving in that direction? Based on the research compiled for this video, dietary nitrates daily through leafy greens and beets, magnesium through food or supplementation in consultation with your doctor, resistance activity 2 to 3 times weekly, no gym, no equipment required, time-restricted eating within a window that your schedule and health allow. And the single most important intervention of all, a direct, informed, specific conversation with your physician about every medication you take and whether it is still the right choice for the person you are today. Not the person you were when the prescription was written, the person you are right now. That conversation is your right. That information is yours, and you now have what you need to have it. Don't stop here. Click the video on your screen now. This is where most people get the real results. If this helped you, subscribe so you don't miss the next one.